Hi friends, myself Dr. Ayush. So today we'll be discussing in this video a very important topic, which is the general management of trauma patient. Be it your MBBS curriculum or your entrance exam, be ready to face questions from this, not only on your exam based scenarios but also in your real based emergency scenarios. You will be coming across this trauma patient management scenarios, right? So we follow the ATLS protocol, which is the Advanced Trauma Life Support Protocol, and it includes your primary survey, right, secondary survey, and definitive care. So today we'll be limiting our discussion to primary survey of the patient. So what does the primary survey include? The primary survey includes the ABCDE, right? And I have included a small c over here. So what is the c? We shall be discussing this. This is the exsanguinating external hemorrhage, right? So if a patient comes to you in your emergency setup where he's bleeding profusely, the first important thing that you need to do is you need to stop that bleeding externally, right? It could be done with the help of an application of a tourniquet, or using of ice bag, or using of some hemostatic agents which we shall discuss subsequently. And the ABCDE over here stands for: A for the airway control, B is for the breathing, C is for the circulation, D is for the disability, and E is for the exposure. So the first point that we discuss is the exsanguinating external hemorrhage. So it could be due to a massive arterial bleeding. What we need to do is that we can apply packs and apply pressure directly onto the wound or onto the artery if it is visible, right? There might be use of the hemostatic dressings that we can use, which basically alter the coagulation pathway, right? And then we can use a tourniquet. Now for example, if my hand is bleeding from here, I can apply a tourniquet over here. What it is going to do, that it is going to prevent the blood supply forwards, but at the same time it is also going to stop the blood supply to the healthy parts, and it might lead to the ischemia or the anoxia, right? And as a result of which the gangrene may develop, right? So if a tourniquet is applied, it has to be time checked, right? So time checked if the tourniquet has to be applied. Then we come down to the next component of the ATLS of the primary survey, which is airway with cervical spine control. Please remember that cervical spine is mandatorily needs to be checked along with the airway. You cannot miss the cervical spine. So you need to mobilize the cervical spine, right? And then we assess the patient's airway. Now if the patient is able to speak and talk to you, that means the patient's airway would be fine. We locate the nostril, nasopharynx, or the oropharynx. Now if there is any blood or vomitus that is seen, it has to be suctioned out. If the patient needs any assistance, we first try with the simple airway maneuvers. The simple airway maneuvers would include your oropharyngeal airway or the nasopharyngeal airway. Now if this fails, right, then we can go for the endotracheal tube or the intubation, right? And in some cases there might be need for the doing of emergency cricothyrotomy or tracheostomy. These two itself are very important topic which we shall discuss in some other video later on, right? So in case of airway with cervical spine control, the most important point to be remembered is the cervical spine immobilization. Along with that, the patient airway needs to be assessed. We need to locate the nostril, nasopharynx, and oropharynx. We have to suction the blood and the vomitus if any present, and use of simple airway maneuvers like oropharyngeal or nasopharyngeal airways. If it fails, then the advanced airway, which would include the endotracheal tube, and then emergency cricothyrotomy and tracheostomy may be needed in some of the patients. So this was all about your airway with cervical spine control. Now we move to the next letter, which is B. Right, so breathing. In breathing, we basically give high flow oxygen. We assess the breathing, we expose, inspect, palpate, percuss, auscultate. Right, now remember, this is a primary survey. We do not go for a detailed examination, right? We basically, the main aim in case of breathing is to look for the life-threatening injuries, right? So life-threatening injuries. Life-threatening injury. So over here, your main life-threatening injuries life-threatening injuries would be your tension pneumothorax. So we do not wait for some adjunct investigations like X-ray and all to diagnose. Now, if you feel that yes, the patient is having tension pneumothorax, you immediately treat the patient, right? So immediately we treat with needle thoracocentesis, right? So the recent edition, which is the 10th edition of the ATLS, says that this to be done in the 5th intercostal space, right? So it's no more the 2nd intercostal space in case of adults, it's 5th intercostal space, right? And we look for the ventilation. If needed, the patient has to be ventilated, then yes, we need to ventilate the patient. So please remember that the life-threatening injuries have to be identified in case of when assessing the breathing. It's not a detailed examination, rather a quick examination, right? Like a tension pneumothorax or even a massive hemothorax. So there are life-threatening injuries and which are immediately life-threatening injuries or potential life-threatening injuries, which we shall discuss in our subsequent videos, right? So now the next part comes the C. C is for circulation. So what we do in case of circulation? In circulation we have IV cannula, right? So we make wide bore cannulas, right? So we wide bore cannulas, which is for the fluid resuscitation. At the same time, we send the blood for the cross match and hemoglobin and assess the lactate levels. The pulse and the blood pressure needs to be measured. The patient needs to be resuscitated, right? The fluid resuscitation needs to be done, right? And the responder is when we resuscitate the patient, it could be a responder, a transient responder, or a non-responder. So responders are those whose rise of blood pressure on the maintenance on giving the bolus dose of fluid, and on maintaining fluid dose it maintains. The transient responders are those who does not maintain with the maintenance fluid. That is, when you give around a 250 to 500 ml of saline bolus, their blood pressure might shoot up, but then on giving a maintenance fluid it again falls. And non-response responder itself says that it does not respond to your fluid challenge, right? In case of circulation, I would like you all to remember a few more important points, right? There is something an antifibrinolytic drug in the market, which is the tranexamic acid, right? So it has been suggested by some trials like the crash trial, right? Crash 2 trial. Giving of tranexamic acid is going to prevent the morbidity and mortality in major traumas, right? Prevent mortality and morbidity, right? So it is going to reduce, not prevent, rather you can see it is going to reduce the risk of mortality and morbidity. It should be given within less than 3 hours of injury, right? And it should be given if the systolic blood pressure is less than 110 and heart rate is more than 110 per minute, right? What is the dose? It is given 1 gram IV over 10 minutes, followed by 1 gram IV over 8 hours. So please remember this tranexamic acid dose, right? So it is, I'll write it down for you all for here. It is tranexamic acid, right? And you need to make sure that this fluid resuscitation should not be excessive fluid. Excessive fluid should not be done. Why? If we give excessive fluid, it is going to cause hemodilution. It is going to cause coagulopathy, right? And then there's another term which I would want you all to remember is the massive transfusion. So massive transfusion protocol is 1:1:1. So what is in this massive transfusion protocol? 1 packed red blood cells, 1 portion of plasma, that is FFP, and 1 portion of platelets, right? So these are the few important points which I would want you all to remember in case of circulation, right? Then comes your disability and exposure, right? You need to have an adequate exposure to obviously check for the other any injuries which might have been missed, right? And also to prevent hypothermia, and this disability assessment is done by GCS, an AVPU scale, and at the same time your pupillary assessment. Right. So this is what we have, your mental status assessment by the AVPU scale, where A is for your alert, V is verbal, response to verbal stimuli, P is for response to painful stimuli, and U is your unresponsive. Right. Then we have this Glasgow Coma scale score. This is a very important topic. Please remember that do not forget revising this before you go for any of your exam. It is going to be invariably asked to you directly or indirectly, right? So we have three parameters, which are I, then you have your verbal response and your motor response. As you can see, the scoring over here, everywhere is a one score of a minimum, so it tells you the minimum score has to be 3, right? You cannot even hear that a GCS score of 0, 1 or 2. The minimum score has to be 3, and your max score is your 50. So what are in your eye? A score of 4 is allotted if it is a spontaneous eye opening. A score of 3 if it eye opens in response to the verbal stimuli. If it is response to pain or a pressure, it is a score of 2, and a non-opening of the eye is a score of 1. Similarly, in case of verbal response, if the patient is orientated, it is a score of 5. If it is confused, a score of 4. Words, it's 3. Only sounds, score of 2. And there is no response, it is given a score of 1. Similarly, in case of motor response, if it is obeys command, it is 6. Localizing, 5. Normal flexion, 4. Abnormal flexion, 3. Extension, 2. And no response is a score of 1. Please remember that you always take the best motor response. Right. So this is all about your primary survey. Now we shall be discussing about the secondary survey in our next video. So I hope you all were able to understand this basic primary survey of the ATLS, because unless you understand this basic primary survey, there is no point in going to your secondary survey. Now regarding those chest life-threatening injuries, each of them are very exhaustive topics on its own, which we shall be discussing separately. But please do remember that you need to know this basics of primary survey. What I have taught you all is each and every point being the must know points, right? So that's for it today. Thank you.